Greetings everyone. My name is Wani. I'm a urology trainee in Wales Deanery in UK. I'm going to present comparison of anticholinergic drugs to beta-adrenergic agonists in overactive bladder, a systematic review. Mr. Masood was the consultant with whom I carried out this review. It was a self-funded project. Definition: the International Continence Society defines overactive bladder as a syndrome consisting of urinary urgency with or without urgency urinary incontinence, usually with frequency and nocturia, in absence of infection or pathological conditions. Epidemiology: on an average globally, 16% of men and 16.9% of women report having symptoms of OAB. Problem impact: financially, in year 2000, US spent around $12 billion for patients suffering with OAB, while in Europe in year 2009, it was approximately $10 billion. Individually, OAB is associated with poor quality of life, high depression scores, and poor sleep quality. Treatment part: the primary aim of treating physician after diagnosis of overactive bladder is to help in reduction of occurrence of bothersome symptoms and improve quality of life for the patient in a meaningful way. It includes number one lifestyle modifications, which may or may not be helpful. The reason being it needs considerable patient motivation and lack of regular follow-up or due to lack of efficacy. And usually it is used as an adjunct to pharmacotherapy. Pharmacotherapy: antimuscarinic or anticholinergic drugs form the cornerstone for management of OAB. They reduce both OAB symptoms and improve quality of life. The disadvantages include limited efficacy, side effects like dryness of eyes, dryness of mouth, blurring of vision, constipation, and issues with cognition, particularly in elderly people. Another problem with these medications is that persistence and adherence rates can be less than 35% within the first year of initiating treatment. The other group of medication used is beta-3-adrenergic receptor agonist Mirabegron. With an improved efficacy as well as tolerability profile to existing treatments, it has become clear that Mirabegron can take a role as either second line or adjuvant or an alternative therapy. The aim of this systematic review was to compare Mirabegron with anticholinergic or antimuscarinic and see if it can be used as a second line adjuvant or alternate therapy. We used PRISMA guidelines, and total 190 studies were initially found using healthcare database HDA software. After removing duplicates, 151 studies were found. After screening, it came to 23 studies, and in the end, 20 studies were used for qualitative synthesis. This is depicted in the PRISMA flow chart. Results: there are two tables. If we look at the right hand side table, we have the results from 20 studies. So 7 were systematic reviews, 6 were retrospective cohort studies, 3 were prospective cohort studies, 2 were randomized controlled trials, and 2 were cross-sectional studies. If we look at characteristics compared, 9 studies compared efficacy of both these medications, 5 studies compared adverse effects and persistence and adherence rates. The other aspects which were evaluated included cost effectiveness, tolerability, female-only studies, combination of antimuscarinics, and Mirabegron, switching from antimuscarinic to Mirabegron, and effect of medications on urodynamic studies in patients with OAB. Efficacy: these are the results now. Mirabegron is as efficacious as any other anticholinergic. It has been found to decrease even post-wide residual urine. Adverse effects: Mirabegron has less side effects as compared to antimuscarinics. Dry mouth with Mirabegron is that of placebo. Persistence and adherence: Mirabegron has better persistence as well as adherence as compared to antimuscarinics. Cost effectiveness, Mirabegron is cost effective as far as anticholinergic across the globe are considered. Tolerability, Mirabegron has better tolerability as compared to antimuscarinics in elderly. Female-only studies have revealed that Mirabegron is a very good alternative in overactive bladder. Combination of antimuscarinics and Mirabegron. Latest studies have found that combining Mirabegron with sulfonylurea has excellent results for patients. Switching from antimuscarinic to Mirabegron, study have revealed that switching has had excellent results in groups patients in terms of efficacy, tolerability, and AE profile. Urodynamics has found to improve after change to Mirabegron in terms of post-wide volumes, particularly in females. So what we conclude from this study is that Mirabegron is as efficacious as any other antimuscarinic, has better tolerability, including elderly, has adverse effect profile better than any antimuscarinic. It is cost effective compared to antimuscarinic, and it has better persistence and adherence rates at 12 months. Limitation, it was a literary review, limited to 5 years. Studies without full articles were excluded. These are the references. Thank you. I'm happy to answer any questions.